So today we are going to discuss about optic neuritis. The term optic neuritis is itself saying itis, that is, it is inflammation. It is inflammation of the optic nerve. So let's discuss. Optic neuritis is the inflammation of optic nerve. It is of three types: papillitis, retrobulbar neuritis, and neuroretinitis. What is papillitis? Papillitis is the inflammation of optic disc. The disc part of optic nerve will get inflamed, that is papillitis. Then comes retrobulbar neuritis. Retrobulbar neuritis is the inflammation of optic nerve except the optic disc. Here the term retro means behind. So retrobulbar neuritis means behind the optic disc. That part is inflamed. Except the optic disc, the entire optic nerve will get inflamed in retrobulbar neuritis. Then is neuroretinitis. In neuroretinitis, there is inflammation of macula and the optic disc. Okay, you can see in the picture also that red part is showing the inflammation in the optic nerve. Then next is papillitis. Means now we will discuss all these three types of optic neuritis in detail, one by one. First is papillitis. Papillitis is the inflammation of only optic disc and it is most commonly seen in children. The optic disc will show edema and it will be hyperemic. Because of inflammation, it will be swollen. That is papillitis. Then next is under retrobulbar, it is the inflammation of optic nerve except the optic disc and it is commonly seen in adults. Then next is neuroretinitis. So neuroretinitis is the inflammation of optic disc and macula. So it will present with macular star appearance due to deposition of exudates around macula. What happens in neuroretinitis is on the macula there is deposition of lipid exudates which will give it an appearance of a star, that is called as macular star appearance. So this is macular star appearance. Macula is looking like a star because of the deposition of exudates. Now we have this slide which is showing comparison between all the three types of optic neuritis: papillitis, retrobulbar retinitis and neuroretinitis. In papillitis, inflammation of only optic disc seen in children, and hyperemic optic disc and edema will be seen due to inflammation. Retrobulbar retinitis, inflammation of optic nerve except the optic disc, and it is seen in adults. And since it is behind the optic disc, retrobulbar, behind the optic disc, so the doctor cannot see anything. So you cannot see how will the nerve appear. You cannot see that. Okay. So it is commonly seen in adults. Then next comes neuroretinitis. It is the inflammation of optic disc and macula, and macula will present with macular star appearance due to deposition of exudates around macula that we have already seen in the previous slide. I have already shown you the appearance of that macular star appearance. Next comes clinical features. So what will come under the clinical features of optic neuritis? So you can remember that with the mnemonic. Do cup mar means 2 times cup, CUP, CUP. So for 2 times C, 2 times U, 2 times P. Then mar is Marcus gun pupil, that is the earliest sign. Then 2 times C. One C is for central scotoma, another C is for color blindness. Then for 2 times U, one is Uthoff sign, that is the exacerbation of symptoms. Symptoms will increase due to increased body temperature like exercise. And another U is for unilateral loss of vision. Then 2 times P, one is pain on ocular movement and the other is pulphic phenomena, that is altered perception of kinetic objects, so moving objects. There will be altered perception. Okay, so do cup mar. 2 times C, 2 times U, 2 times P, and then mar is for Marcus gun pupil. So these are the clinical features of optic neuritis. Then next is treatment. So how can you treat optic neuritis? You can go for the optic neuritis treatment trial where you will give IV methylprednisolone 1 gram daily for 3 days, and then you will give oral prednisolone 1 mg per kg per day for 11 days. If you give only oral steroids, then there will be increased risk of recurrence of optic neuritis. And this treatment of giving steroids, it will hasten recovery, but it won't affect the visual outcome. Okay, means the visual loss that is going to happen, it won't affect that. Okay, the next is CHAMPS trial. Under it, beta interferon IA is given to reduce the risk of complication like multiple sclerosis. Then the third is glatiramar acetate, and it is given 20 mg subcutaneously. Thank you.